I mentioned earlier to all the people who were here when I was interviewing Jeff for another issue that, I feel like the most important functional forum talk that we've ever had was in May 2014, where Dr. Jeff Glad came in and shared what he called Integrative Medicine 2.0. And in that talk, he shared how there was a real possibility. It's arguable whether or not functional medicine is working in big institutions. We've got the Cleveland Clinic, which is exciting, but we can't really do anything about that. You've got like other examples of clinics not being continued and not growing in an institution. But what is possible right now is what Jeff called the micropractice revolution, and that is a low overhead practice. And so I asked for Functional Medicine 2.0. I asked Jeff to come here and do another talk that could really show everyone what's an opportunity for every practitioner out there. So please give a warm Illinois welcome to your rival Indiana State friend, Dr. Jeffrey Glad.
I am looking for freedom, looking for freedom, and to find it, 'cause
Thank you. I got M&M 2 years ago when I did this. I'm going back a little bit of ways. Okay, we'll talk about what I call Integrative Medicine 2.0. So I use integrative and functional interchangeably. I come from Arizona in the program there, so I'm integrative based, but practice the functional way as well. So there's a lot more similarities than there are differences. The 2.0 part is lots of practitioners and students email me or come up to me and say, which program should I go to? Where should I go get this education? And I say, yeah, you have to be careful. The content is a blessing and a curse. It's a blessing because it's very, very important content that we need to be delivering to patients and practicing ourselves. But it's a curse because it's expensive, and if you're going to just stay in the same model of practice, you're actually going to be less productive trying to use this, or super frustrated because you just don't have the time to put it in place. So to me, Integrative 2.0 is how do we actually use this to change our practices, to see patients, and to build a network of providers that can do the things that Tom and James were just talking about. So I have to start every talk with Fat Jeff, as James calls it. So 10 years ago now, 50 pounds heavier, busy primary care doctor, 30 to 40 patients a day, treating myself out of the drug rep closet, samples of SSRIs for my panic attacks, and largely just not happy with personal life or career. Committed myself to Whole Foods, realized that was a powerful tool, lost 50 pounds in 6 months, and said, boy, I didn't learn any of this in medical school or residency. But yet it completely transformed my health. And so I went and grabbed every content and every book I could find on nutrition to learn about why and how I could use this with patients. Went to the nutrition conference put on by the University of Arizona and Dr. Weil and joined that fellowship. Meanwhile, had just taken my solo family practice to the hospital, like everybody does nowadays, and said, I don't want to do primary care anymore. I want to practice this. I can't sit with patients and write more scripts and double medication and add more meds. I have to talk to them about what they're eating and how they're sleeping and what their relationships are like. So the hospital let me do that, surprisingly. And I had an insurance-based hospital integrative practice where we were doing consultative medicine. And over that time, started a .com and spun that off, but then eventually transformed the hospital-based practice into my own private practice, and we'll talk about that in a bit. And along the way, started a nutrient depletion calculator, mitavan.com, that's free to use. You can use it with your patients, plug in the medications they're on, find out the nutrients that they're potentially being depleted so that you can help them in that way too. So why does this integrative functional care model work? Why do these practices work? Why do they attract so many patients? It teaches. You get to instruct patients and you get to walk them through what's going on in their bodies. I stumbled upon the term let's see, I have to think of this, cyberchondria, right? We've got a problem with Google because everybody's going there for their medical information. They're typing their symptoms in there and they're learning all kinds of cool stuff, crazy stuff. But now there's actually some studies to show that patients are talking themselves into odd diseases and really severe diseases just by reading on the internet. Why? Because they don't have a medical practitioner that they can spend any time with. They get 7 minutes. And ma'am, you've already talked about your headache, so you can't talk to me about any more of your symptoms. You'll have to come back next week. So we get to teach. We get to teach a lot. And we get to walk them through what they've learned, what they're concerned about, why they're concerned about it. And we can empower them to make the changes they need to make. It's one of the blessings of practicing the way I do. I don't wear my patients' diseases when I go home anymore on my shoulders because it's their lifestyle and it's their decisions and it's what they're doing. And they accept that, and that's why they come to see us. It's connecting. It's building that relationship. Like Tom said, you spend time listening to a patient, and for the first time they get listened to, and the tears pour down, you've already healed them. You've already helped them just by spending time with them. And we're focused on the root cause, right? You're trying to figure out where this all came from. Was it the antibiotic prescription? Was it the C-section birth? Okay? Conventional practices that a lot of us are trying to practice in, or I was trying to practice in, it's about efficiency. How can you do more with less time? Our practices are about relationships. How do we build these relationships, create healing relationships, and guide patients toward better versions of themselves from a health perspective? What do you have to do to be able to deliver care like this? You need time and you need connectivity. You need an environment that allows you to sit in a comfortable space and meet with them. You need to be free of your stress and not thinking about the 10 other patients that you have to see the next hour. You need to use technology to connect with them and use it to your advantage. But there's no CPT codes for these. You can't bill for the stuff that you really need to deliver this care. So in my hospital-employed version of this practice, I was putting out a third of the production needed to keep it afloat. They came to me a year and a half later, Jeff, we love what you do. You have a 6-month waiting list. This is incredible. We just need you to see 3 times as many people. Then we're good. And I knew that I just couldn't do that. I couldn't have the same relationships. I couldn't deliver the same care in that environment. My connectivity, being on the internet, emailing patients, connecting with them, using the phone, using Skype, unbillable time, right? Donated time. So now I'm spending more and more time on a practice and not generating any revenue from that to support the business. So I realized something had to change. And I needed to do it in a different way. I needed to do it for me, to build my, let my life dictate my work, not my work dictate my life. And so I had to create a model that would allow me to do that and to enjoy it and to be fresh when I showed up in the morning enjoying work. But I also had to figure out who I was really working for in this environment. Was I representing the healthcare system and working for a system that's leading me toward population-based care and sort of cookbook medicine? Was I working for the hospital? I was obviously employed by the hospital. That's who was signing my check. That's a little bit of a different focus than the one that I was most interested in. And a lot of times I felt like I was working for the insurance companies, representing them in my care for patients. Who did I want to work for? I wanted to work for my patients. I wanted to work for the people who are motivated to come see me, who are coming to me saying, help. I've been here, I've been here, I've been here. I've spent God knows how much money on these tests, and they tell me it's all in my head. How can you help? So I created a practice that allowed me to do that. We've been doing this now for 6 years. It is a consultative, direct pay practice. So I bill for the time that we spend. We bill for the time we spend with our patients. It's myself as the only physician, but we have 2 nurse practitioners, one of which is my wife. We have a registered dietitian that teaches our nutrition, and we have a health coach that also does our nutrition content. We use a lot of email and technology to sort of connect with our patients. What I realized was, since I graduated medical school, I was the de facto primary care doctor for friends and family. But I never saw them, right? It was an email, it was a phone call, keep me out of the ER, what do I need to do? Why couldn't I have that same relationship with my patients? So I needed to find the technologies that would allow me to have that connection and to utilize that to help guide their care. And I knew I needed to leave that insurance model because I wanted to work for patients. So that's our little practice. Again, the micro-practice concept is low overhead. We're in a strip mall, right? And we didn't have this big Taj Mahal build-out. It's a very small space, but it's a peaceful space. It's a healing space. I use the big iMac, and I have my patients sit right next to me. And I turn the computer going through their labs, going through their recent hospitalization, going through supplements that they're on or things they have questions about. So how do we scale this, right? How do we do this across the country and not just in one little practice in Fort Wayne? We know the model works. We've been going for 6 years. We see 25 to 35 new patients every month. I am in the clinic 2.5 days a week. My personal lifestyle is fantastic and balanced, and I am by no means overworked. I love what I do every day I show up at the office. We need to scale this to be able to connect with more and more patients. So I started thinking about how we do this and thinking about where we're headed in terms of the big picture and where this is all drawing us to. And now we've got big box stores that are doing most of the sales. We've got online big box stores like Amazon. We've got mostly chain restaurants serving our food. We've got big food industries delivering most of our food, big insurance, and we have big medicine, right? This is big population-based care. Most of us are working for hospital systems. And so all of this stuff is getting bigger and bigger and bigger. And so how do we reconnect and how do we divert this towards something where we can start to really affect healthcare? So I looked at the AAFP. What are they doing about it? And they've created the Patient-Centered Medical Home, which I'm still not sure what that means exactly, but it sounds really neat. A medical home sounds good, but you have a lot of providers who don't have the content to deliver a talk on nutrition or connect the dots on how stress is affecting them. How are we doing it with food? We have farmers markets, right? We have farmers markets everywhere. We have local farmers selling their goods directly to the customer in their own environment. So I wanted to create and marry those two ideas, so I've come up with the Integrative Medical Home, an heirloom, organic, micro-focused on empowerment, right? Heirloom because it is just the roots of medicine, right? It's Hippocrates and all of the great fathers of medicine and what they taught in terms of organic because it's real and it's very just relationship built between a patient and a provider. The micropractice build the Taj Mahal. Patients will come see you. Provider, it's empowering for the patient. And so think about those farmers markets. Show up to these farmers markets all over the country. This was my original slide from 2 years ago. Here's all the farmers markets in the country 2 years ago. And I said if we could have an integrative or functional practice in every one of these spots, we could really start changing healthcare. And there's no reason why we can't do it. Those hundreds of thousands of people showing up at every one of those red dots is a client interested in the type of care we deliver. So then I wanted an updated version. I assume it's changed. I assume it's gotten bigger. So this is the USDA, and here's the video of what that looks like. All of our patients showing up to buy local food, right? That are also interested in taking care of their family, and their kids, and themselves. So there's no reason why we shouldn't be putting small integrative medical homes in all of these areas. What's keeping us from doing it, right? There's a lot of fear. I do consulting for physicians, I teach business courses, and there are a list of fears. They are all very legitimate fears, right? We fear failing financially. We fear getting in trouble, meaningful use, ICD-10, CPT codes, HIPAA. All this regulation is designed to keep you employed so that you let somebody else worry about it. I have a hard time taking cash from patients, right? I have a hard time having that conversation. I'm scared of asking patients for money. And I'm afraid my community just isn't going to get it. Dictated by outside forces, and I'm afraid of work dominating my life where I can't have balance. Okay? Again, these fears are natural. We're all high achievers. The reason we're in this, at the place we're at is because we've done, ACE tests and been at the top of the class all across the board. So failing is a really risky proposition. We're risk averse as a population, and the system is intimidating. Okay? And it's only going to get more intimidating, so it's going to be hard to want to play in that sandbox. But some of this is unfounded fear. Demand for this care is at an all-time high. And if Tom O'Brien can get 1 million people to watch this docuseries, now there's 1 million more people who are going to demand this type of care, this type of conversation. Conventional care and the care that's being provided in your communities makes it real easy for you to step out and be unique. Patients are looking for you. The out-of-pocket expenses keep going up and up and up. Patients are paying more out of their pocket for medical care. Patients are customers. They know what a deal looks like, and they know how to invest in value. And a lot of times your care outside of an insurance model can be less expensive than what they're paying for the 7-minute office visit that's getting them nowhere. And all of this regulation, how do we deal with this? Again, it's all built for this big corporate, big medicine system. But if you go and you step outside the box and you practice a micro practice that leaves insurance, it looks a lot more like a lemonade stand. This is my 2 kids, the CEO of the lemonade stands, my daughter there. My son is the VP of marketing, and he attracts people to the lemonade stand. They have a unique product that people want to buy, right? You do too. Customers are willing to pay. You've got to figure out what's keeping you from being able to deliver this care and practice in the way you want. Okay? Having these money talks, patients are comfortable with them as long as you bring it up and you're open and honest. Okay? You've got to figure out what you're worth. And you've got to be just fair and transparent about what you're trying to do, why you're practicing in this way, why you're leaving insurance on their terms. A lot of billing for time, patients constantly look at the clock, they're constantly looking at their watch, it's not an adequate visit. Not true. I've had that maybe once or twice in 6 years, but I've had 500 times where a patient says, I'm sorry to take up your time, but I really would like to ask you another question. I apologize, I'm wasting your time. Patients don't see it that way. This is an extremely valuable service that patients are desiring. It takes you having a story, knowing what that story is, being able to tell it, and having passion for what you're doing, because patients will be willing to invest in that. Now, will your community get it? I don't know your community, but I can tell you about mine, all right? Men's Health did a survey several years ago on Is Your City Stupid? And Fort Wayne was #1 or dead last, rated as the stupidest city in the country. The USA Today was looking for signs of intelligent life in Fort Wayne, Indiana. So if you don't think your community will get it, we've done it for 6 years. We started in the middle of a recession, and we're only getting stronger. Your community will understand. You don't need fancy testing. You don't need the Taj Mahal. You don't need really in-depth treatments. They're nice to have. You can learn them as you go. You just need to deliver care. That's the commodity. That's the secret sauce of healthcare that everybody's looking for. I watched the Functional Forum on January last year to listen to Dr. Nicholas Gonzalez, who's no longer with us, talk about his care. I knew that he had a really complex protocol and supplements, and I wanted to kind of learn what some of that was out of that talk. The single most important determinant in how a patient does is their attitude, their beliefs. And if you can just find a practice that taps into that allows you to let the patient share that, have an attitude toward healing, have a belief in what you're providing, that's where the success will come from. Start small, don't start gigantic. Start with a low budget and do things as inexpensively as possible. Be yourself, be honest, be transparent, and go out into your community and go get viral. Okay? You don't need to be a national celebrity. You do need to be a local celebrity. Go give talks, go meet people, go meet the patients who are interested and want to know what you're doing. Thanks.
Thank you very much.